We'd like to thank Ronen for bringing us the tip of the iceberg of biology of the valves, and ask Bob to give some conclusion remarks to close this interesting session.
First, the world stands on Hakarat HaTov. So I have to acknowledge many things. First, when I asked all the people who've spoken so far, thank you very much for organizing this meeting, they said, I didn't do it. So I have to thank, by default, I have to thank Amit Segev and Chaim Lotan for having organized this meeting, as well as organizing a fantastic, fantastic program for the 60th anniversary of the Israel Heart Society. It's something really to be proud of. I think some of the best sessions I've attended at any national or international meeting. Second, I have to say the classical phrase, Mikol Mlamdai Hiskalti Umitalmidai Yoter Mikulam. Much of this work, most of it is due to the people whom you've seen and who were speaking earlier. I've learned so much from them that I would never, ever, ever have been able to understand or do, whether it's fluid mechanics or surgical techniques or the combination of echocardiography and basic science imaging or genetics. This is, I've grown as they have grown, and it gives me great. You know what nachat is? Nachas gives me great pleasure to see how they've all succeeded and become happy in their endeavors. So I don't have the slides, please. In the few minutes that remain, excuse me. Okay. So I wanted to celebrate Israeli leaders in cardiology, the people who've spoken today, who've returned to Israel after an exciting period in Boston. They have several common characteristics. First, dedication. Dedication as clinician scientists. They spend time sometimes having to sell their cars and leave their families for prolonged periods of time in order to come to Boston and have a dedicated period of time to mature and grow as independent researchers. Secondly, they have a dedication to building the profession in Israel. They always had in mind that this was the purpose for which they came, to build and create structure and enrich cardiology in this wonderful, wonderful land. And the third thing they were dedicated to was excellence. No matter what they did, it had to be done at the highest level with the greatest degree of precision. They have all become leaders in their local and national and international venues, and most importantly as well, they're collaborative investigators. They work together, and I'll show you an example of that a little bit later on. Now, I have to say, I've been a little bit jet-lagged, and I haven't really had time to winnow all the slides here, so I apologize in advance. I may go through this a bit quickly. So I'm going to mention the people whom we're celebrating today in the order in which they came to Boston. Dan Gilon, of course, was the first, the pioneer, the chalutz. He's now professor of medicine, Mehaminyan, in cardiology at Hadassah Hebrew University. He's the director of non-invasive cardiology at the Heart Institute, the vice dean of the Faculty of Medicine. Very proud of his accomplishments. He's a lead investigator in the International Registry of Acute Aortic Dissection, so you'll see him in all those papers that that Kim Eagle was talking about yesterday. He's made contributions in the area of MVP and stroke, breaking old beliefs that are incorrect, 3D echo and the hemodynamics of valve disease. He's studied cardiac function in the oldest old in collaboration with epidemiologists in Jerusalem. He discovered, along with Ronen Be'eri and Ehud Razin, a new mechanism of myopathy based on a loss of a transcription factor that had never thought to relate to cardiac disease. And of course, he was a Young Investigator Award winner from the American College of Cardiology. By the way, I should emphasize, all these individuals are young. So there's no such thing as, the best is yet to be for every one of them. Ehud Schwamenthal, as you can see, also has a wonderful family life. He's has been the director of cardiac rehabilitation and of the cardiac outpatient clinic at different times at the Taylor Shomer Sheba Medical Center. He also directed the Echo Lab at Munster University before he made Aliyah. So at this point, I wanted to say that Ehud, I hope I'm not embarrassing you, is the only person whom I know who is asked to become faculty at Harvard Medical School without his having requested that. And he's the only person who turned it down, because he said that he and his wife were dedicated to moving to Israel, and if they stay longer in Boston, they never would do that. And one should be very, very proud of him. He's a professor of medicine at Tel Aviv University, and also a very creative and ingenious innovator, founder of Ventor Technologies, and actually developed the what's now called the Medtronic Embracer, that the first and probably the only TAVI that was designed with fundamental physical and mechanical principles in mind, as opposed to merely empirically. And he's also the founder of a heart failure company called Magenta Medical. He's much of what the work that we do in our laboratory really stemmed from the things that he started when he was there back in the mid-90s. Original mechanisms and hemodynamics of valve disease at rest and also with exercise. He's championed the idea that we must evaluate valve disease at exercise, talking about MR and obstruction in HCM, ischemic MR and MS. That paper that he showed you some slides on about the size of the valve in AI versus ischemic MR. It's incredible. It's an idea that he had just, we were talking about mitral valves at his home in Ra'anana. He said, what happens in AI? And it turns out that this may be the body's solution to the ischemic MR problem. He's studied a lot about the quantification of valve regurgitation. We talked about yesterday, innovative development of cardiac devices, Kellerman Young Investigator Award, Neufeld and AHA. A great person in terms of innovation. Sorry, everybody is that way. I don't mean to exclude anyone. Alik Sagi is the director of the Echo Unit and the Valvular Heart Disease Clinic at Rabin Medical Center. He's professor of medicine at Tel Aviv University. Sorry, that's a duplicate slide. He's made his major contributions in the area of tricuspid regurgitation, its mechanisms, its importance in rheumatic disease, in functional TR, long-term progression of valve disease, thrombolytic therapy for prosthetic valve thrombosis, mitral annular calcification as a window to atherosclerosis, the value of exercise echo. And he's also been, I believe, the leader of the working group in echocardiography, as have several other individuals in the group for the Israel Heart Society. Noah Liel, I think was the fourth person to come. She's now the director of the Echo Lab at Soroka, and she chairs the Israeli Working Group on Echocardiography for the past 4 years, in addition to having won an ACC Young Investigator Award. She spends a lot of effort in developing the profession of sonography here in Israel, training people to think about not just to get images. Most importantly, and I haven't shown any other data slides, but I wanted to emphasize this Israeli echocardiography research group. I think this is a fantastic thing that combines people from many centers, including many of the people here in the room here, to achieve multi-center results that otherwise would be impossible. And that strength, she basically applied, has already been published, studying the visual versus quantitative assessment of global and segmental left ventricular function, published in 2010. And then she took techniques that she had been studying in the EP lab in rats and mice of segmental strain analysis, and conveyed that into a multi-center study showing that segmental wall motion abnormality can be assessed by a new automated technique that gives you longitudinal strain. And this is probably a better way to quantify the burden of coronary disease in patients in a non-invasive fashion. So very proud to see that it's a multi-center study by the Israeli Echocardiography Research Group. And in fact, there's another study in the pipeline being headed by Avinoam Shiran about the utility of the strain in patients presenting to the emergency room with chest pain. So this is a great mechanism, an engine for discovery in Israel. Ronen Be'eri, by the way, I have to thank everyone for their wonderful comments. He introduced to me everything about apoptosis and cardiac remodeling. That's all something that he taught me. He's associate professor of medicine at Hadassah Hebrew University. He's a visiting scientist at Harvard, and if they knew what was good for them, they'd make him a professor there too. But it's hard to be. They don't like people to be professors at two institutions. And he really made these pioneering discoveries about the independent role of ischemic MR in ventricular remodeling, developing by dint of very, very long and hard effort over the course of years. That model that he showed you with a shunt, showing that ischemic MR independently increases not only ventricular diastolic size, but also systolic size, impairing contractility at a very, very fundamental level. And as he showed you, there's exhaustion of the compensatory mechanisms that occur in the presence of regurgitation. Early repair reverses LV remodeling. Late repair, it's too late. And which he didn't show you, gene therapy to the adult heart can actually limit this ventricular remodeling. He's had many prizes, most notably the Neufeld Memorial Research Award of the U.S.-Israel Binational Science Foundation, and from this morning, the Michelle Morawski Excellence in Cardiology Award, which is a signal honor. And of course, Dan Guillon, introduced me to being part of the international committee on that. And he's had grants from the BSF, the Heart, Lung, and Blood Institute of the U.S., the Imaging and Biotechnology Institute, American Heart Association, Israel Cancer Association. He studied ways to eliminate the toxicity of doxorubicin in cancer treatment. And he's I don't think I put that in there. He's the director, maybe. Yeah, okay. He is a modest man, as are all the people here, which is the characteristic of many great people. But he directs the basic cardiovascular research laboratories at Hadassah Hebrew University. Chaim Lotan, of course, has started that is a great builder in that regard, and very, very proud of that, to have basic research associated with the clinical department. Ronen has discovered a population of cardiac resident stem cells from the left atrial appendage, something that others have tried to do, like Ken Chen, and failed, and he succeeded, and that was just published and presented, including at this meeting, an incredible potential for curing many forms of heart disease. He's doing finite element modeling of the heart with people from the Israel Air Force, and is a leader in education in Israel, setting some of the cardiology boards. You can ask him for questions later. No, and also helping design and working with ultrasound companies to improve our imaging. Moti Vachuri, another very modest man who's done a lot of careful thinking. He's a very creative thinker. That what he showed you about the MR, the tricuspid regurgitation in patients with pulmonary hypertension, is a completely original idea. He works with Professor Sagi at Rabin Medical Center, and very proud of his contributions on TR and heart failure, mechanisms of TR, and also more recently on the role of endothelial progenitor cells in potentially, as they get weakened, in promoting the degeneration of bicuspid aortic valves in patients. So also getting at the basic biology. Chaim Yosefi, one of the most hardest working fellows who was in our lab. Not everyone actually worked extremely hard when they were there. He's director of the non-invasive cardiology unit, an associate professor at Barzilai Medical Hospital, and has accomplished an enormous amount in several areas of focus. Echocardiography. I was very, very proud to be present at the first Israel 3D echo course that he organized in Ashkelon, and where he was teaching 150 people from across Israel and people coming from Europe as well about this new technology, how to think about it, how to use it, how to improve patient care through images and quantification. Great advance, and he's been doing this subsequently. There's a lovely lady in Boston. She's probably almost 90. And she always says, how is Chaim and his machine? Because he managed, when he was in Boston, to raise several $100,000 for a machine at the latest 3D echo machine that they didn't have. I was there before grant deadlines, saying Chaim needs his machine at Barzilai. And he got it. So, and he's done much work. You saw in Vena Contracta by 3D, PISA, the basic mechanisms now for quantifying regurgitation. But he's also had a larger focus, which is delivering medical care to the broader community, improving public health, hypertension, decreasing atherosclerosis, cardiovascular prevention, and starting even at an early age, the Perach Chalav approach of taking medical and nursing students. That's how he met his wife, to preach good medical practices out in the community. And you can see, unfortunately, I got here and it was 2:30, and I didn't have enough time to edit this. But Ronen Durst, Acharon Chaviv, I'm also very proud that he was the instigating factor in organizing the first Israel Heart Valve Society Israel Heart Society valve disease meeting, held in Jerusalem in this past June. And of course, he had two great allies in this regard, Professor Chaim Lotan and Professor Amit Segev, and as well as Professor Dan Gilon and Professor Ronen Be'eri. They really put their heads together, made a joint effort under the aegis of the Israel Heart Society. There were over 200 people there the first day, including many international lecturers associated with this Leduc Mitral Network. And it was a great day with Anne Cribier and Hal Dietz, the progression from basic science to clinical applications and devices. Ronen has to be commended for having that yozma, that initiative to get that moving. He's gotten many awards, including the Golem Award, which is the highest Israel Defense System award for innovation that have contributed to the security of Israel. He's discovered a mutation in Lithuanian Jews that promotes familial hypercholesterolemia. He really has a passion for genetics and echocardiography, and now he's beginning his independent career. He has a grant from the European Union, very prestigious award, the Marie Curie Reintegration Grant, which allows him to develop his career here, as well as other grants from Israeli institutions, a Binational Science Foundation Award, and many other grants. So I think we have here, and he's also establishing, while he's doing all that, an MRI and CT cardiac service at Hadassah. So to summarize, we have many people in this room, all the people who spoke, 8 individuals who've come back, come to Boston, dedicated time, and now have growing careers that are succeeding on an upward trajectory, building cardiology in Israel, making Israel a leading force, putting it on the map, full of enthusiasm, as you can see from their presentations, and also working together and working with investigators throughout the world. We have Professor Emmanuel Messas here from France, another former fellow who's actually now a full professor and chief of Department of Vascular Surgery, working on innovative technology that may change our ability to measure ventricular and vascular stiffness. We have Professor Hajej, who's the chief of cardiology and professor and president of the French Society of Cardiology. You have an national and international network unified by several common themes: dedication to excellence, dedication to research as well as clinical excellence, and building the state of Israel through innovation and creativity. So, Yasher Kochachem, Chazak u'Baruch.